Many people think insulin resistance only happens to people who are overweight. That's not true. A person can look thin on the outside and still carry too much fat around the liver and other organs. This is sometimes called thin outside, fat inside. Even people with a normal body weight can develop insulin resistance. One clue may come from a routine blood test called a lipid panel, also known as a cholesterol test. Some healthcare providers look at the ratio of triglycerides to HDL cholesterol, often called the TG to HDL ratio, as one piece of information that may suggest insulin resistance. In general, a lower ratio is associated with better metabolic health, while a higher ratio may be linked to insulin resistance and an increased risk of heart disease. However, this ratio alone cannot diagnose insulin resistance and should always be interpreted by your healthcare provider along with your medical history and other test results. Insulin resistance often develops slowly. Long before blood sugar reaches the diabetes range, your body may begin showing warning signs. One possible sign is acanthosis nigricans, a condition that causes areas of skin, especially on the back of the neck, under the arms, or in other skin folds, to become darker and thicker. Some people with insulin resistance may also develop skin tags, which are small, soft growths that often appear on the neck, underarms, or eyelids. Other early warning signs may include carrying extra weight around the waist, fatty liver disease, rising blood pressure, elevated triglycerides, high uric acid levels, and blood sugar that falls into the prediabetes range. Many people with insulin resistance also notice that they gain weight mostly around the abdomen, while their arms and legs remain relatively thin. This pattern doesn't always mean someone has insulin resistance, but it can be an important clue when combined with other risk factors. The good news is that insulin resistance is not limited to older adults. It is becoming increasingly common in younger adults and even teenagers, largely because of modern lifestyles that include too little physical activity, excess body fat, poor sleep, and diets high in ultra-processed foods. If insulin resistance is not addressed, it can gradually increase the risk of prediabetes, type 2 diabetes, heart disease, fatty liver disease, high blood pressure, and other metabolic conditions over time. The earlier insulin resistance is recognized, the greater the opportunity to improve it through healthy eating. Regular physical activity, weight management, quality sleep, and guidance from your healthcare provider. Insulin resistance doesn't happen overnight, but the sooner you recognize the warning signs, the more you can do to protect your long-term health. If you found this video helpful, please give it a thumbs up, subscribe, and share it with someone who could benefit from this information. Thanks for watching, and we'll see you in the next video. Stay healthy, stay informed, and take care of your future self.